Dr. Marcus Webb had spent 11 years running the trauma unit at Ashford General Hospital. He was known for his sharp mind, his quick hands, and his short temper. Doctors respected him. Nurses feared him a little. He liked it that way. In his eyes, confidence was the same as skill, and if someone did not speak up in a room full of noise, he simply assumed they had nothing important to say. That was the mistake he made with Elena Castillo. Elena joined the trauma floor on a quiet Tuesday in early spring. She was in her late 30s, with calm eyes and a steady walk that never seemed to rush, even when everyone around her was moving fast. She did not laugh loudly at jokes in the break room. She did not offer opinions during morning briefings, unless someone asked her directly. She simply did her work, checked her patients twice, and went home. Within a week, the staff had already formed an opinion about her. Some thought she was shy. Others thought she lacked experience. Marcus barely thought about her at all. To him, she was just another nurse on a long list of nurses, someone who followed orders and stayed out of the way. What nobody at Ashford General knew was that Elena had spent 6 years as a combat medic before she ever wore a hospital badge. 3 of those years had been in active conflict zones, far from clean hallways and beeping monitors. She had treated soldiers in the back of moving vehicles, in muddy fields, in places where there was no time to wait for a second opinion. She had learned to read the human body the way other people read a book, quickly, instinctively, and without panic. She never spoke about it. Not because she was ashamed, but because she had learned a hard lesson early in her civilian career. The moment she mentioned her past, people stopped treating her like a colleague and started treating her like a story. They asked endless questions. They wanted details she did not want to give. So she decided it was easier to simply do her job well and let her past stay private. For weeks, this worked fine. Elena settled into her role on the trauma floor, quietly impressing the head nurse with her calm efficiency, though no one made a big deal of it. Marcus, in particular, paid her almost no attention. He was busy, important, and used to being the smartest person in any room. He did not have time to notice the quiet nurse in the corner who rarely said a word. There was one afternoon, a few weeks before everything changed, when Elena tried to mention something to him. A patient's vital signs had shifted in a subtle way, something easy to miss if you were not looking closely. She approached him calmly and explained what she had noticed. Marcus barely looked up from his chart. "I've got it under control," he said. "You don't need to worry about this one." Elena did not argue. She simply nodded and stepped back. She had learned long ago that some battles were not worth fighting, especially when the patient turned out to be stable in the end. But she remembered that moment. She remembered the way he had dismissed her without even looking at her face. Then came the night that changed everything. It started like any other busy evening in the emergency department. Sirens echoed outside as ambulances pulled in one after another. A multi-vehicle accident on the highway had sent several patients to Ashford General at once, and the trauma bay quickly filled with movement, noise, and urgency. Marcus was assigned to the most serious case, a young father in his early 30s who had been pulled from his car with a deep injury to his abdomen. His name was Daniel. He had been driving home from his daughter's school event when another car lost control and struck his vehicle. Paramedics had done what they could on the way to the hospital, but his condition was unstable, and the medical team knew they had very little time to work with. Marcus moved fast, the way he always did. He called out orders, checked the wound, and began the standard procedures he had performed countless times before. The team around him followed his lead, fingers moving over equipment, eyes scanning monitors. For a moment, it looked like things were under control. Then Daniel's blood pressure began to drop in a way that did not match the pattern Marcus expected. It was strange. The wound itself did not seem severe enough to explain the sudden change. The numbers on the monitor kept slipping, slowly but steadily, even as the team worked to stabilize him. Marcus frowned at the screen, running through the usual explanations in his mind, but nothing quite fit. The room grew tense. Voices rose. Someone called out for more fluids. Someone else asked if they needed to call for backup. In the middle of this growing chaos, Elena stood near the foot of the bed, watching closely. She had been assigned to assist with the trauma cases that night, and she had been quietly observing Daniel's condition since he arrived. Something about the pattern on the monitor felt familiar to her, in a way that made her stomach tighten. She had seen this before. Not in a hospital, but in the field, years earlier. She remembered a soldier who had looked stable at first glance, his outer wounds appearing manageable, while something deeper and more dangerous was happening beneath the surface. His body had been compensating, hiding the true extent of the damage, until it was almost too late. The pattern of his vital signs, the way his pressure dropped slowly instead of suddenly, had matched exactly what she was seeing now on Daniel's monitor. She stepped forward. "Dr. Webb," she said, her voice steady despite the noise around them. "I think there's internal bleeding that the wound site isn't showing. His body is compensating right now, but it won't last much longer. We need to look beyond the visible injury." Marcus, focused and stressed, barely glanced at her. "I'm handling it," he said sharply, the same words he had used weeks before. "Just keep the fluids going." Elena did not back away this time. She had learned, in the years she spent treating soldiers, that there were moments when staying quiet could cost a life. This felt like one of those moments. "With respect," she said, louder this time, "the bleeding pattern matches a slow internal hemorrhage, not just the surface wound. If we don't address it soon, he's going to crash." For a brief second, the room seemed to pause. A few of the other nurses glanced at her, surprised by the firmness in her voice. Marcus turned, his expression a mix of irritation and disbelief. He was not used to being challenged, especially not by someone he had barely noticed before. "I appreciate the input," he said, his tone clipped. "But I've been doing this for 11 years. I know what I'm looking at." Elena held his gaze for a moment. She did not raise her voice, she did not argue further. Instead, she said something that made him stop. "I spent years treating wounds just like this one, in places far worse than this room. I'm not guessing, doctor. I'm telling you what I've seen with my own hands." Something about the calm certainty in her voice cut through the noise of the room. Marcus hesitated. He looked at the monitor again, then at Daniel's pale face, then back at Elena. For the first time since she had joined his floor, he actually looked at her, really looked at her, instead of past her. Daniel's blood pressure dropped again, sharper this time. The monitor let out a warning sound, and the room snapped back into motion. "Get me an ultrasound, now," Marcus said, his voice tight. "Elena, talk me through what you're seeing." Elena moved quickly to his side. While the rest of the team prepared the equipment, she explained calmly and clearly what she believed was happening, drawing on years of experience that had nothing to do with hospital training manuals, and everything to do with survival in the most difficult conditions imaginable. She described the signs she had learned to recognize, the subtle clues that pointed to a deeper problem hidden beneath the obvious one. The ultrasound confirmed it within minutes. There was bleeding inside Daniel's abdomen, separate from the visible wound, slowly filling space that his body could not afford to lose. It was exactly what Elena had described. Marcus did not waste time arguing or defending his earlier assumption. He shifted his approach immediately, calling for the team to prepare Daniel for emergency surgery. As they moved quickly through the hallway toward the operating room, Marcus glanced at Elena one more time. "Good catch," he said simply. It was not much, but for a man like Marcus, it meant something. The surgery that followed was tense. Marcus worked carefully, guided by what he now understood about the hidden injury. The extra minutes that Elena's warning had bought made all the difference. By the time he located the source of the bleeding, Daniel's body had little reserve left, but it was enough. Slowly, steadily, his condition began to stabilize. Hours later, as the first light of morning crept through the hospital windows, Daniel was moved to recovery. His vital signs were steady. His family, who had been waiting anxiously in the hallway, were finally allowed to see him. His young daughter, clutching a small stuffed animal, peeked into the room and smiled when she saw her father breathing easily, his color returning to normal. Marcus stood outside the room for a long moment, watching the quiet relief on the family's faces. He thought about how close they had come to a very different outcome, and how that difference had come down to a few crucial minutes. Minutes he almost lost because he had dismissed someone without truly listening. Later that day, after his shift technically should have ended, Marcus found Elena in the break room, sitting alone with a cup of coffee, exactly the way she always did. He hesitated at the door for a moment before stepping inside. "Can I sit?" he asked. Elena looked up, a little surprised. "Of course." He sat across from her, unsure exactly how to begin. Apologies were not something he gave often, and he was still learning how to put one into words. "I want to say thank you," he started, "for last night. If you hadn't spoken up, Daniel might not have made it." Elena nodded but said nothing right away. She was not the type to fill silence just for the sake of comfort. "I also want to ask," Marcus continued, "where did you learn to read a case like that? I've trained with some of the best doctors in this country, and even I almost missed it." Elena set her cup down and considered the question for a moment. Then, slowly, she began to share a small piece of her past. She told him about the years she had spent as a combat medic, working in places where hospitals did not exist, and help was sometimes hours away. She described, briefly and without drama, the kinds of injuries she had learned to recognize, the split-second decisions that had to be made with nothing but instinct and experience to guide her. Marcus listened closely, something he rarely did with anyone. As she spoke, he realized how wrong he had been to judge her by her quiet manner. Her silence had never been a sign of weakness or inexperience. It had simply been the calm of someone who had already faced far greater pressure than anything Ashford General could offer. "I had no idea," he admitted when she finished. "I'm sorry I brushed you off before. That won't happen again." Elena gave a small, genuine smile. "I appreciate that," she said. "I don't need the spotlight. I just want to be heard when it matters." From that day forward, something shifted on the trauma floor. Marcus began to seek out Elena's opinion during difficult cases, not because he had to, but because he had learned to value what she brought to the room. Other staff members noticed the change as well, and slowly, the quiet nurse who had once been overlooked began to be recognized for the depth of skill she carried with her every single day. Elena did not change who she was. She remained calm, steady, and unwilling to seek attention for herself. But within the walls of Ashford General, she no longer had to fight to be heard. Her experience, once hidden behind a quiet exterior, had finally found its place, not through loud words, but through a single night, when speaking up made all the difference between life and loss. And for Daniel, the young father who returned home to his daughter, none of them ever knew just how close that night had come to ending differently, or how a nurse's quiet courage and years of unseen experience had saved a life that almost slipped away.